Good evening, my name is Rindy. I'm going to be assessing you for my advanced health assessment of the heart, chest, and lungs. So let's get started. We'll first start by inspection of, we'll start with the cardiac system, so we'll start with inspection. We just want to make sure there's no visible color changes. He's consistent with ethnicity. So at that point we could inspect for the apical impulse. So I'm just going to have you lean forward just a little bit. Okay, and I'm able to see that right in this area, which is a normal finding. So then you can move on to palpation. And so you start at the apex of the heart. And you're trying to find that point of maximal impulse, which should be no more than 1 centimeter. And then once you find that, you can check it with the carotid pulse. And they coincide, and that is S1. And then that also coincides with the systole. So then you move to the left sternal border, the base of the heart, and then the right side. And I'm just feeling for any heaves or lifts, and I'm not able to feel any of that, so those are all normal findings. And then at that point you can move on to percussion of the heart size, but an x-ray is actually a more reliable resource, so that was done prior and his heart was found to be a normal size. So we'll move on to auscultation of the heart sounds, and I'm listening for S1, S2, and maybe S3, S4, and just want to make sure that I don't hear any murmurs, gallops, or rubs. So we'll start by listening to the first part, which is the aortic area, and that's in the second right intercostal space. And you can just breathe normal through this. And then we'll move on to the pulmonic area, which is the second intercostal space on the left side. And then Erb's point, which is the third intercostal space. And the tricuspid area. And then lastly is the mitral area, or the apex, and then you just want to be sure you're timing that. That's where you get your rate, and you want to time it for a whole minute. And for timing purposes, you would listen for a whole minute, but we're going to listen for 30 seconds. Okay, so his is 68, which is a normal rate for his age, and then the rhythm is also normal. And so as I was listening for normal rate and rhythm, S1, S2. I wasn't able to hear S3 or S4. I also didn't hear any murmurs, gallops, or rubs, so that's a good sign. And then the last thing you can do while you're listening to the mitral area or the apex is you can listen and you can make sure that that also coincides with the carotid pulse. And it does perfectly. So at that point we'll move on to the chest and lungs. And so again we'll start with the anterior chest, and you just want to start by inspection. And you can actually inspect around the lips, make sure there's no cyanosis. You can check the fingertips as well, make sure they have good keep refill, they don't have any clubbing, and he doesn't have any of that. And so then you want to find your landmarks, and so you want to make sure the trachea is midline. You find that suprasternal notch, and then you also find the costal angle. And so, and then just make sure again no color changes or anything like that. You watch for retractions, any signs of distress. He doesn't have any, so we'll move on and go to palpation. And so you're just palpating for any crepitus, and I don't feel any, and then any tenderness. Any tenderness in here? Nope. Okay, great. And then you want to, so then you can percuss. And what you want to percuss when you're percussing the chest and the lungs is just, you want to listen for a resonant sound, and you want it to sound the same on both sides. And that does. So that's a normal finding. And then we can also, while we're doing that, we can check for symmetrical expansion of the chest. And so you just do that by finding your costal angle, and you have them take a deep breath in and blow it out. And you just watch your thumbs and make sure that they're symmetrical. Okay, and those are. And then the last thing we can do is check for tactile firmitus, and so I just place my hands in the intercostal spaces, and I have him say 99 and make sure I can feel for vibrations. Say 99.
99. 99. 99. 99.
Okay, and that was normal. I felt it the same on both sides. And so then we would move on to auscultation. And I haven't heard any audible wheezing or stridor, so I'm going to listen to the upper lobes. Take a deep breath. And a deep breath. And then we'll just work our way down, and you always want to compare one side to the other. Okay, and then so at that point we would be done listening to the anterior, so we'll have him turn around and listen, to the posterior. Okay, so again, I would start with inspection. I'm just watching for symmetrical movement on both sides, any color changes, any intercostal retractions, anything like that, and I don't see anything of that nature. So we'll again start by palpation. Is there any tenderness in here?
No.
Great. And then we can again, you could do the tactile firmitus again on the back side if you wanted to. And then we'll make sure that the costal angle is the same. So take a deep breath and blow it out. And a deep breath. And I'm just watching my thumbs and making sure they move with him symmetrically. Great. And then, so the last thing that you want to do is percuss for the diaphragmatic excursion. And so we'll start by taking a deep breath in and holding it. And hold it. Take a deep breath in and hold it. And I'm just listening for where the resonant sound changes to a dull, and you can breathe out. Okay, and then catch your breath, and then take a deep breath in and exhale out all the way. And again, I'm just looking for that change in sound. And so now we'll do the left side. And blow all your air out. And hold it. Okay. And you can breathe normal. Okay, and then get your breath, and then breathe all your air out and hold it. Okay, and you can breathe normal. And so what you're looking for here is the right side should be a little bit higher than the left due to the liver. And then you want to measure and make sure that those are between 3 and 5 centimeters. And his are. So that's a normal finding. And that checks for diaphragmatic excursion. And so the last thing on this that you want to do is auscultation of all the lung fields. Again, you're listening for wheezing, crackles, rhonchi, and you just want to make sure they have normal rate and rhythm and that you can hear them on the left side as well as the right side. And so when I move my stethoscope, just take a deep breath in and blow it out. And so the last thing we'll do is check for vocal resonance. So I'm going to place my stethoscope. I'm going to have him say a word, and I should hear a mumbled sound. Or muffled. So say 99.
99.
99.
99.
99.
99. 99.
Okay. And so those were muffled. I was able to hear them, but they were muffled, not too loud, and they were the same on both sides. So that would conclude the heart, chest, and lungs assessment for AHA. Thank you.